In this section, we look at good pen injection technique and the top tips on this. Now, it's worth noting that even if you're on the pump, the pen is needed for emergency administering of insulin, so it's important to keep fresh on this. Now, one general rule not to overlook is that it's important to look after insulin and keep it refrigerated. If you have insulin out of the fridge for more than half an hour, then it'll only be good for another 30 days. So keep track of your insulin and keep it refrigerated right up until you need to be using it. Now, there are a range of pens you might well be using. Let's look at a common type of pen and how to change the insulin cartridge, which is generally similar across most models. So let's look at setting up a pen, starting with removing a used cartridge. First, you want to unscrew and remove the old cartridge. Reset the plunger. Insert the new cartridge. And then align and reconnect the pen back together. And the needle screws on like this. When you add a needle to the pen, remember to prime up the needle by dialing up a couple of units of insulin, like that. Plunging and ensuring you have drops coming through the needle tip as expected. This primes the pen ready for accurate use. Once primed, you can then dial up the desired units, or in the case of this pen, half units of insulin required for your dosage. Now, always check these values with your diabetes team if you're unsure. Once dialed up, you can then choose an injection site. The common places are the stomach, the thigh, or your backside. Now, your injection action should be straight down, and the needle should easily penetrate the skin without much force. Now, remember to press down the action trigger whilst keeping the needle inserted and count to 10 to ensure the insulin is given time to flow to the site and be absorbed. Then remove the needle in a reverse vertical action. It's important to rotate and vary the injection sites. Over time, if injection sites are not rotated and if insulin is injected in the same place, the skin can get lumpy and hard because of repeated injury. Insulin can build up in these lumpy sites and the absorption can be variable, resulting in blood test results not being as expected. So, to avoid this happening, it's advisable to rotate the injection site for every injection. Now, if you follow a pattern, you can ensure it's days or weeks before the return of the same injection site and significantly reduce the chance of lumps under the skin. Here on this diagram are some example patterns you might follow to achieve effective site rotation between injections. You can ask your doctor for different sizes of needles if you feel you're having a problem using enough varied sites. The needles can come in 4 or 5 millimeter lengths. Now, it's worth noting that if you're on pump therapy, the cannula site rotation is really important for the same reasons, and similar patterns of distribution sites is recommended to try and avoid the occurrence of lumps. A system and routine will really help here to get consistent results and help build confidence in your type 1 management. Always consult your diabetes team if you have any concerns or unexpected results after injecting or changing cannulas. So there you are, some important things to remember about good injection technique and remembering to adopt a system to regularly rotate injection sites. I hope you found that helpful.